like to welcome Dr. Stephen Boateng to the first ever Sickle Cell Conference in Australia, hosted and organized by the Australian Sickle Cell Advocacy Association. Today is day 2, so we are talking about the sickle cell trait and why we should also focus on this. So Dr. Stephen, I will give you the platform, and if you can please introduce yourself to our audience. Thank you.
Thank you. I'm going to try and share my screen real quick while I do that intro. Give me a quick second. Let me know if you all can see my screen.
I can't see your screen.
All right. Is it full screen now?
No.
No.
No, not yet. Not yet.
No?
No.
No. You can still see the slide navigation.
Yes.
Got it. Okay. You know what I'm going to do? I'm going to work my magic. How about now?
Okay, that's perfect.
Perfect.
I know this is a great topic. A lot of people are definitely interested in it, and I know our time is really limited, so I really want to get the most out of it. Take it away.
Thank you. Well, thank you everyone for joining this session today. I am Dr. Stephen Boateng, the Director of Research at Sickle Cell 101. It's a global platform really dedicated to helping education and awareness about sickle cell disease and sickle cell trait. And I'm also the founder of No One Behind Foundation. Foundation really dedicated to helping individuals living with sickle cell, primarily in Africa. So that's really me. And for me, I always want to remind people that I do not have sickle cell disease, but I have a sister who has sickle cell. So that's kind of where this ties in for me. As far as sickle cell trait, I think it's one of the most important topics that we always need to address. You know, for so long, most of the time, of course, rightfully so, we're very focused on talking about sickle cell disease, but you know, the time has come where we need to put emphasis on sickle cell trait as well, because if we really want to move forward with ensuring we get a total care for sickle cell disease, we need to also focus on sickle cell trait. So before I even dive into our discussion today, this is just my disclosure. Here, really no financial or non-financial relationships to disclose. Most importantly, any trait names or identifications are mainly for educational purposes only. So what I will do today is kind of give a quick overview of sickle cell disease, sickle cell trait. I'm sure we all know too much well about both of these topics. Talk a little bit about some correlation between the two, right? Sickle cell disease and sickle cell trait in terms of inheritance and demographics. And most importantly, touch on some of these potential complications that the medical literature is providing now. And of course, at the end, I have a couple of recommendations and next steps, and hopefully we'll have more time for questions. Again, I'm not going to belabor this point here. We all know what sickle cell disease is. I think the key takeaway here is for us to remember that there's no sickle cell disease without sickle cell trait and vice versa, right? So for anybody to get sickle cell disease, they should have inherited 2 copies of the S gene from each parent. So that's really kind of a key takeaway from this slide, and we can kind of go on and on and talk about sickle cell disease. I'm sure you all are experts at sickle cell disease, so we'll just skip and move on. All right, so when we start to focus more about sickle cell trait, I think what is important is that, you know, sickle cell trait is really when an individual carries only 1 copy of the S gene. I will always like to mention that there's so many different types as well. But it's also important that, you know, for the sake of education, we're going to kind of put emphasis on S for today. You know, as we know so far, there's over 300 million people worldwide that have sickle cell trait. If you pay close attention, I said over. Why did I do that? Because a lot of people that carry sickle cell trait, I say, unfortunately, do not know their trait status. And I'll show you guys a compelling slide as we move forward, and it'll tell you more about why I think there's a huge gap over there. Typically, in general, with sickle cell trait, it is considered as benign or asymptomatic. I put a lot of question marks over there because there's still a lot of unknowns that we need to learn about, you know, not even just for patients or caregivers, but even for those of us in the healthcare space, right? A lot of my colleagues, people still call me and try to learn more about sickle cell trait because it's still so new. You know, I'm a pharmacist by training, even medical doctors, and even pharmacists and nurses also talk about going through school, and no knowledge was given to them about sickle cell trait. So again, it's a huge gap. And when I put benign or asymptomatic, that's what we've known. But I think the narrative needs to change around this topic. And so, when you think about a correlation between sickle cell disease and sickle cell trait, I think these are pretty self-explanatory, right? I always like to remind people, whether it's sickle cell disease or sickle cell trait, anybody can get any of these. The truth behind it is that it disproportionately affects individuals primarily of Black or African descent. But that doesn't eliminate somebody else because they have specific race or ethnicity, right? So the sickle cell disease, sickle cell trait, typically seen in sub-Saharan Africa, people of those origins, Central South America, and everyone else on this list here, I won't belabor it. But a key takeaway here is that anybody can get it, although it disproportionately affects people from Black or African descent. There's some numbers here that do highlight, kind of the numbers, specifically here in the US. I think one that's really fascinating is that about 1 in 13 kids that are born that are African-American are born with sickle cell trait. And we're still learning. This number, to me, I always say could always be higher, especially a lot of epidemiology colleagues. And they always tell me there's a lot of gaps we don't know. So I think it's still fascinating that we need to learn more about this and provide more education around it. And so if you are just curious to learn about why sickle cell trait is and where it came from, the hypothesis so far from the medical literature is really sickle cell trait evolved to serve as a protective factor against malaria. For lack of a better term, sickle cell trait was kind of our body's own way of outsmarting a disease that was killing a lot of people. Again, like I said, typically think about the origin of the disease, right? And so for people that have sickle cell trait and sickle cell disease, I want to be clear and say, it doesn't mean they cannot get malaria. It doesn't mean they cannot get severe side effects from malaria. If you think about people with sickle cell disease, they actually tend to even experience malaria at its worst, primarily because they have a weakened immune system too. For people with sickle cell trait, because they have that one copy of the sickle gene, when they get infected with malaria in certain cases, and in most cases I would say too, that red blood cell can sickle. And when it sickles, that oxygen gets depleted. And if you think about malaria, if you know a lot about this malaria parasite, Plasmodium, they use oxygen as their fuel source. And so our body's way of making sure that malaria parasite doesn't survive or thrive is that depleting the cell of that oxygen by sickling in sickle cell trait, thereby malaria parasite dies. So that's really where this came from. But again, I always want to remind everybody that people with sickle cell trait, sickle cell disease can still get malaria, although the severity of complications might be less in those with sickle cell trait. So that's really where sickle cell trait came from. That's why we are here today, right? Ultimately, it resulted in when two people have sickle cell trait, they have a child born with sickle cell disease if the child carries an S gene from each parent. All right, so we know a whole lot about the potential complications of sickle cell disease, right? The cardinal ones, right? Pain, vaso-occlusive crisis. But what do we know about potential complications associated with sickle cell trait? Again, I put the word potential here because the science is still evolving. And I think there's a couple of definite ones, but I'm going to kind of walk through some of these and kind of learn and provide some key insights about what we know so far and what the scientific literature is telling us. And so one of the things that I think is important for us to remember is that when you think about the potential complications of sickle cell trait I talked about, these typically occur under certain extreme conditions. This is not, an expanded list, right? But these are some of the typical conditions that can predispose an individual to having complications associated with sickle cell trait. Dehydration, increased pressure in atmosphere, low oxygen, high altitude, and you name it. And really what happens is that it can lead to muscle breakdown, reduced supply of blood to different parts of the body, causing ischemia and infarcts, kidney and cardiovascular complications, among many others, including pain. And I'm going to even expand on even these further. So let's take a closer look at these medical complications and where did this even come from? I think it's starting to come in the news a lot. One of the biggest stories that happened this year is that there's a big New York Times article about sickle cell trait and police using that as cover. And I'll touch on that briefly. But even before that, I pulled this here because this is from 1987. Sickle cell trait was being studied and potential complications were being evaluated. I think it always boiled down to how much funding do we have and where do we need to put our resources? I think it's fair that the resources needed to go to where sickle cell disease is. But to be honest, the term sickle cell trait and these potential complications have been around for a while. People have been suffering in silence for a long time. And I think it's important that we kind of understand what we've been so that will help us figure out where we're going. And so I also want to expand on this. This is one of my favorite charts I always like to pull from one article that I like to read. And it kind of shows kind of this strength of association between some of these potential complications we're learning about. It's quite an expansive list over here. But when you think about, whether it's chronic kidney disease, renal medullary carcinoma, and then a whole other ones here, these are complications that can occur with sickle cell trait. And I think it's important to also mention that a lot of these that you see in the medical literature, some of these are case reports, which might be, a few patients in there, but they're happening. And so it kind of speaks to the fact that we need to do more research and identify more of these as we move forward. And so I want to touch on, the one I first touched on was exercise-induced rhabdomyolysis. It's kind of the biggest one that we tend to hear a lot about in terms of sickle cell trait complications. There's a couple of pictures here and a couple of different highlights I put on here. I'm here in America and I love football. And for now, actually, it's actually becoming more open that players are able to talk about it. One most prominent one is this player up here on the left, Ryan Clark. He had his spleen removed because he played football in Denver, which has a high altitude and had complications from sickle cell trait, almost died from it. So this is nothing benign. Someone almost lost his life. Somebody unfortunately lost their life. Right in the middle, this student from Chadron State, he died from exercise-related complications. And we keep hearing a lot of these stories. Athletes collapsing because proper precautions are not being taken for those with sickle cell trait. So again, I highlight all of these to show that these things are real and there's nothing really benign about this. The last one at the bottom right is a sad story. This guy actually died end of last year from renal medullary carcinoma, 27 years old. Sickle cell trait, one of these complications I'll touch on is RMC. So again, as far as exercise, some of the ways that is important that coaches and parents, you need to pay attention to these is, one, educating their kids if they do carry sickle cell trait, if they want to exercise. Having sickle cell trait doesn't mean you cannot pursue your dreams of being an athlete. You can do anything you want. You just have to be cautious and take proper precaution. And so, I've kind of listed out some of these things that you might see when you might have someone being at risk. I think it's important. And hydration is kind of the mainstay here. And people just, warming up and taking proper precaution before engaging in exercise activities that may be strenuous on their bodies. All right. So as far as cardiovascular complications, there are three main bullets I put here. These are three separate articles. I think what's important here is that, again, a lot of case reports, right? The first one is looking at cardiovascular outcomes in African-Americans with sickle cell trait and chronic kidney disease. Although a small sample size, this study did show that for those that had sickle cell trait, there was some additional risk factors that were associated with coronary artery disease for those individuals. So there's nothing really benign about this. I think it's important that we are aware of it. The one in the middle was one patient, it's catastrophic sickling that happened for this patient with sickle cell trait that was undergoing transplant. Again, I think if these doctors had been aware that this person has sickle cell trait, I think they could have been able to catch this and this person wouldn't have died. This is good for us to identify and take proper precaution. The last one is talking about atrial fibrillation. Again, key takeaway here is that a lot of small sample sizes, a lot of case reports, but these things are happening and we can no longer turn a blind eye on people having sickle cell trait and expressing their complications. When I talk about cardiovascular, again, this one here, this is my pharmacist hat coming on. When you talk to people about hormonal contraceptive, one of the things you always want to advise women about it is the fact that you can get a venous thromboembolism related to anybody can. But the risk actually is a little bit higher for this specific study for those that had sickle cell trait. Again, small sample size, but it's important that we educate people about it. My most important takeaway from this study is that there are about 34 people in this study that previously they had no clue they had sickle cell trait until this study happened. I think that's probably the most important message, is that people need to be aware and be active and trying to find out what their trait status is, because you never know. You never know what could happen. And again, RMC, I think I've talked about that expansively, right? Unfortunately, this specific type of kidney cancer, you actually tend to see more, over 90% people that have sickle cell trait, much more younger people. And it is happening. The sad thing is it has a really, really worse prognosis. So when people get this specific kidney cancer, unfortunately, they don't live for too long. And and really unfortunately, most of those people have sickle cell trait. Although it's rare, it's important that we educate everybody, know what the proper precautions are, so that we don't have to keep seeing most of these happening. Cancer. This one here was kind of a study looking at patients that had, individuals that had sickle cell trait that had a different form of cancer. How are they responding to treatment? I think it was fascinating that for those that had sickle cell trait, the complications associated with the chemo they got was a little bit higher. Again, small sample size, but it tells us something that we need to pay closer attention to it. This one is also one of those that I think is super important. This has been confirmed. So according to the National Institute of Diabetes and Digestive and Kidney Disease, the hemoglobin A1C assay, it might be unreliable to diagnose diabetes for those that have sickle cell trait or other hemoglobinopathies. So if you're not familiar, typically for people that have diabetes, the way it is diagnosed, you can use the blood sugars, the 24-hour glucose test. One of the biggest mainstays is the hemoglobin A1C, right? 7 or below is a good number. What we're seeing is that for those that have sickle cell trait, it might be faulty. So it's important that if someone has sickle cell trait, they communicate with the doctor, making sure the test that is being used is the right test. There are other tests that can bypass that, but most of the time, even doctors do not know that. So it's important that, doctors, patients, caregivers are aware. If someone gets diagnosed with diabetes, let's find out, what test did you run? Is it a test that sickle cell trait might interfere with? Maybe let's do a follow-up test just to be sure, right? Because you don't want to have someone being diagnosed with diabetes taking metformin or insulin when truly they didn't have diabetes, or even other way around. I think that's another important thing that we typically don't see a lot, and we need to start paying close attention to it. Again, as I kind of bring this to a close, I think we need to have an appreciation of where the history of screening and testing has been. This specifically here in the US, right? This is 2006. That is where all 50 states in the US kind of mandated sickle cell trait testing, where every child being born is getting tested. So trust me, I'm sure like we know, there's a lot of people that were born before 2006 that are still living. So a lot of people still living around that do not know they have sickle cell trait. Take this data and extrapolate it. Take it to Africa. Take it to other continents. It will tell you a lot. A lot of places don't have universal screening. So again, it's a huge gap as far as people who do not know their trait status might be having complications, or maybe not. But I think the key takeaway here is that there's a huge gap around testing. We need to pay close attention to it. For my work at Sickle Cell 101, we dedicated July to learning more about sickle cell trait. This is one of probably my favorite engagement posts we put on our social media platforms. About a year and a half ago, we asked people, when did you find out you have sickle cell trait? I'm not going to have you guys read all of these, but the theme that kept coming up a lot is a lot of people find out they have sickle cell trait when they have a child born with sickle cell disease. I don't think it's fair. I think we can do more about it. And why is that happening? It's because testing is not there. I think at the end of the day, parents deserve to know so they can make an informed decision about childbirth. And I think we see this way too often, which is why for me and even for my two organizations, our goal is to make sure that these conversations keep happening. True appreciation for this organization putting together this conference and even adding sickle cell trait to the topic, because you don't want to be that parent that finds out, you have a beautiful born baby. Now the kid is going to live the rest of their life in pain and all of these different things. Unaware. I think it's something that we need to keep talking about. Again, I think, as we all know, really sickle cell trait presents as a health disparity. There's a lot of poor communication going around. Even here in the US, I can speak more to the US. People, when they find out they have sickle cell trait, for some hospitals, they just will send a letter. And how many people open letters? How many people might see a letter that might look like a spam and never follow up with it? Or why are hospitals not taking the initiative of taking stuff a step further and calling the patient, calling the parent, and educating them? There's a huge gap over there. And I think the last bullet I have here, I bolded it on purpose. There's a lot of uneducated medical professionals that have no clue what sickle cell trait is, what potential complications are, or what to even teach and train people about. So again, presents a huge gap. And that's why we need to keep having these conversations, because truly sickle cell trait presents as a health disparity. This is what I was talking about earlier. It's made the news a lot. And, unfortunately, it presented as where sickle cell trait was being used as a cover for these police officers. Thinking about it in both ends, right? Both sides of the spectrum. I think the key message from me here was that the more education and awareness we have about sickle cell trait, the more informed we will be. And think about these pathologists and even, these people that were evaluating these people that were dead probably didn't know much about sickle cell trait. That's probably why most of these cases ended up being closed. So again, it really revealed the fact that we need to talk more about sickle cell trait, more research, more education, because there's really a true gap over there. In closing, I think these are my recommendations, all the way from infancy all the way to, adulthood. I think genetic counseling should always start early. Education, like we're doing here today, should always be paramount. Educating kids about if you have sickle cell trait, it doesn't mean you have a disability. You can do anything you want. If you're exercising and you feel like you're not well, tell your coaches, stay hydrated. These are the conversations we need to start having and making it open so kids can even tell us more if they don't feel good. And again, carrying that genetic counseling all the way through onto people who want to get married and have kids. Let them know that they have sickle cell trait and be able to make informed decisions if they want to move forward about childbirth. I think it's important. We can't rob people of that privilege. Again, for me, what I always want to stress is that sickle cell trait is not sickle cell disease. People with sickle cell disease, I have a ton of respect for them. My sister has sickle cell disease. They battle a lot. It's not the same here. But we need to understand that there's something also going on with sickle cell trait, that we cannot turn a blind eye on it because it is not benign. Like I said, it can happen to anybody irrespective of race or ethnicity. And I think we need to keep educating healthcare providers as patients, caregivers. Be your own educator. Teach and challenge these healthcare providers so they can take better care of you. Again, as I always like to say, sickle cell disease and sickle cell trait, they are not mutually exclusive. This is my last quote. This is one thing I always say. To me, I think there's going to be never any meaningful impact made on sickle cell disease unless we address education, awareness, research, and these potential issues I talked about related to sickle cell trait. That is how, as a sickle cell community, we get total care, quality, holistic care. That is how we really achieve it. You're probably wondering why this bucket is here. For me, I think about sickle cell disease now, getting a lot of traction, rightfully so. We're pouring into the bucket a lot. We need to seal these holes. What are these holes? It's a sickle cell trait education, sickle cell trait awareness. We cannot ignore that. And I think when we do that, we can help the whole community in general. I think there's a lot of things going on that we don't know much about. But as the science keep evolving, I've dedicated my time doing a lot of research and digging into the data. And I encourage everybody on here to do the same. When you find out, ask your doctors, reach out to, experts over here, people organizing these different events, and learn more. When we all learn together, that's how we learn best. And I think when we put emphasis on sickle cell trait and sickle cell disease, we get a holistic care for the people that deserve it. That's all I have for today. Again, thank you all for listening to me. This is my contact over here. Feel free to connect with my foundation. You can reach us at NOB Foundation on all social media platforms. And at Sickle Cell 101, you can just look up Sickle Cell 101 and you can find us on either platform. So that's all I have. And I think, I'm tracking the time. If you guys see me looking, I have 2 minutes. So let's see if any questions come in.
Yes, there are plenty of questions, Dr. Boateng. That was a super informative session. Really good. I don't know if you want to read through those, or so you can. There are quite a number of those.
Yes, so let me skim through it.
Okay.
I think one I'm seeing here is from Natalie's asking about the influence of sickle cell trait on life. Natalie, this is what I think. I think the key message is, the primary thing is everybody should know their trait status. I don't care where you're from, who you are, just know your trait status. And then 2, if something isn't right, you know your body better than your doctor. I always say doctors are not the first expert. The patient is the expert, and then the doctor helps them. If something is not right, ask your doctor. Tell them you have sickle cell trait and see if it might be correlated. I think that is how you can ensure you get quality of life. I think sickle cell trait does impact the life of some people, not all. There are people that have sickle cell trait experience nothing, and there are others that have to deal with a lot. So I think that's what I would say for that question, Natalie. And great question, Natalie.
That's not correct. I posted it as the moderator, but the question is actually from KW Young, so one of our very active participants. So KW,
Okay.
there's your answer. Yeah.
I see. Okay. Thank you. Let me see.
One technologies question.
Let me see. I'm gonna keep going. Have you found women with sickle cell trait having also been diagnosed with breast cancer? Not that we know yet. Not that we know yet. There is no really true correlation with that. But again, I think one of the studies I showed did show for people that had some form of cancer, the experiences with those treatments were a little bit worse when they had sickle cell trait. It's a lot of evolving research. There's no true direct correlation there, but it's worth studying and evaluating. It's a great question. Does benign mean non-problematic? I love this one. Non-cancerous. Yes. So typically when you hear the word benign, it typically means, it's dormant. It's something that's really not causing any problems or issues. That's really what that term is. I think we need to scrap that when we think about sickle cell trait. Are there any deaths reported as sickle cell trait related mostly? The most deaths that I typically hear about, unfortunately, has to do with renal medullary carcinoma. And it happens really fast, unfortunately. All right. Did you mean?
Yeah,
go ahead.
For it. Yeah, there are a number of other questions. I think there was one on the correlation between diabetes and SCT. I think that was from Caroline. Caroline was asking, what is the connection between diabetes and SCD and the constant craving of sugary taste in the mouth?
That's a great question. So there isn't really a direct correlation between, for people, let's say if someone has sickle cell disease, they are more predisposed to getting diabetes. Or for someone with sickle cell trait, they are more predisposed to getting, sickle cell trait getting diabetes. There's no correlation there. What's important is that anybody can get diabetes, right? Based on all of different things that can happen. The key takeaway is that making sure whether you have sickle cell disease or sickle cell trait, the proper test is being used. Because if not, you might be misdiagnosed for either of the two. So there's no true correlation, but the test that is being used can be wrong if it's not done properly. That's kind of the big key takeaway for that.
Okay, really good. And my one question is that, because I have seen that a number of people have reported having complications due to having the sickle cell trait. And a lot of the time, it seems that they are basically dismissed by medical professionals. Yes, they're always told it's benign, it's totally asymptomatic, it doesn't really matter. But I know of one. So one of our members has actually reported having had issues with strokes and really having complications similar to sickle cell disease, except she's always he only has a sickle cell trait. Why is there this reluctance to actually invest into more research to find out more? Because clearly there are correlations. What is it about? I'm just wondering, what is the resistance to the research, the resistance to hearing these patients? And
it's a sad truth I'm going to tell you. The reason why there's a huge resistance to that is, unfortunately, there's really a lot of money. When you think about a lot of research, unfortunately, you invest in something that you're going to get a return, right? You think about sickle cell trait, because we know for so long there's really nothing going on over there. It will take a lot for someone to say, I'm going to dump my money in here, knowing that, what could I gain out of it? Think about sickle cell disease. I can put research over there, and if I find something, maybe I can get a drug. This is no shade to any drug company or anything like that. It's rightfully so, right? So you can do research, find a cure or anything like that. But with sickle cell trait, there's really not a lot of money coming out of it if you do it. I think that's why there's been that big gap. Second thing I would say too is the fact that a lot of doctors are prideful. Doctors hate to admit they do not know. I like to challenge my fellow healthcare providers. And I think that, I was telling one of our patients on our board that I said, the olden days where doctors think they can go sit at a table, tell a patient what to do, and the patient listens, it's over. This new world we are in, people can fire doctors. And so doctors come in, they're prideful, they think their medical textbook is all they know, they don't want to learn from patients. I think patients should fire them. And unfortunately, I think your question is is why we're having this conversation. Just nobody wants to invest in it, and doctors don't want to listen to patients. These are valid concerns. And I think if I were a patient and a doctor pushes back on my care when I know my body better than they do, I'll fire them. And I just challenge them to do better. That's kind of how I would answer that.
Okay. Well, thank you very much, Dr. Boateng. We have reached the hour. This was a really great session. We got a lot of information from you, and we definitely look forward to connecting in the future.